Everyone, this is Chadi Alraies coming to you from NCVH 2025 in New Orleans. I'm really privileged to be with Mary Yost, who's one of the co-chair of the NCVH conference, focusing on the cost and the business aspect of medicine in patients with peripheral artery disease. Mary, thanks again for being with us. Offline, we spoke about the cost of this disease and how it's not very studied very well, and we don't know how the burden of this disease on the community and the healthcare.
Yeah, this is a very expensive disease. Our most recent estimates are that it costs between 340 and 670 billion.
Wow.
And those costs are higher than coronary artery disease, all cancers together, all kinds of other diseases.
Wow.
And this is a very expensive disease. And one of the reasons that it's so expensive is that patients are, there's a number of reasons, but one of the reasons is that patients are diagnosed and treated at the later stages of the disease, such as critical limb ischemia, rather than at intermittent claudication.
And that's end up with amputation, and then the burden will go higher.
Right. I mean, that's a big factor, because obviously, well, if you look at CLI, the rate of amputation increases with Rutherford category severity of ischemia. And so, you know, if you catch the disease at Rutherford 4, there's a much lower rate of amputation. And amputation, it's interesting, in the hospital, amputation, the initial procedure cost is similar between amputation, endovascular, and bypass. But what drives up the cost of amputation is the fact that it's associated with a huge number of expensive complications, such as wound infection, kidney disease, or kidney failure, those types of things, in-hospital mortality, and multiple revision procedures in the hospital. And that drives up the cost compared to endovascular and bypass, which have a much fewer complications that occur at much lower rates.
Yeah. And also the burden of that individual who or she or he going to leave her job because of amputation, that's a downstream effect on the community and on the cost.
Yes,
as well.
that is, it's a burden in two ways. One, if that person was in the workforce, then we lose the productivity of that individual.
That's true.
But an even bigger impact is the fact that frequently these people can't work and they can't care for themselves after an AKA or a BKA, and so somebody in the family has to take care of them. So then they have to either give up their job, take a part-time job, lesser job. They lose the benefits, the Social Security benefits, insurance, all kinds of other things. So it has a huge cascading effect on the economy.
So what are we doing to make aware of this problem?
Well, there have been a number of programs. First of all, the awareness of PAD is extremely low in the consumer, the patients, and the families. And there are a number of programs. The AHA has one. Different companies have programs to increase awareness. But we need more of this, and we also need more campaigns targeted to those at high risk. And there are certain groups that are at high risk: African Americans, Hispanics, Native Americans, and interestingly, women are at also higher risk for amputation.
Compared to other populations, yeah. Well, I mean, at least, I mean, it's an eye-opener for me personally to see the burden of the economy, on the economy, as well as the lack of awareness and lack of discovery of this disease. But what NCVH does wonderful is bringing a wonderful kind of awareness program, putting multidisciplinary, starting from podiatry, vascular surgery, interventional radiology, and cardiology, and then treatment option for these patients.
Yeah, I mean, that's very important, because patients don't know to go to a vascular surgeon or an interventional cardiologist. You know, they usually come in the system some other way, either through a podiatrist, their primary care physician, endocrinologist, whatever, and educating those groups of doctors about PAD and how terrible it is very important.
Absolutely. Yeah. Well, Mary, thank you so much for your time and for enlightening us on this very important aspect of PAD awareness and the cost of this disease on the healthcare. Watch the videos and others on NCVH YouTube channel. This is Chadi Alraies coming to you from New Orleans, NCVH 2025. Mary, thanks again.
Thank you.